All right, so I want to talk about the hand. We talked about the arm already, so let's talk about the hand. And the hand is going to include all of your carpals, which are your wrist bones, your metacarpals, which are the major bones in your palm of your hand, and then your phalanges, which are all of the bones in your fingers. So big thing here when we look at this is I'll talk about the carpals and your individual mnemonic to remember that. Whenever we number the digits, we number them starting with the thumb and ending with the pinky. This one happens to be an anatomical position, so this is the anterior. So we're looking at the left hand. So this is going to be the left hand. So we have the thumb here, we have the index finger, the middle finger, the ring finger, and then you've got your pinky. So whenever you look at these, you're going to notice right off the bat that the thumb seems to have less bones in it than the rest of the fingers. Okay, so this is digit 1, digit 2, digit 3, digit 4, digit 5. Why is that important? Because when we talk about numbering the metacarpals and numbering the phalanges, we have to know which digit it belongs to. So this is metacarpal 1, metacarpal 2, metacarpal 3, metacarpal 4, metacarpal 5. Okay, then in our thumb we have a proximal and a distal phalanx. So this is proximal phalanx 1, distal phalanx 1. In all of the other fingers, we have a proximal, a distal, and now we have the addition of a middle phalanx. So this is proximal, middle, and distal phalanges, phalanges being the fact that there's more than one. So proximal, middle, and distal phalanges 2, proximal, middle, and distal phalanges 3, proximal, distal, middle phalanges 4, proximal, distal, middle, or proximal, distal, and middle phalanges 5. So when you're looking at it, proximal 1, 2, 3, 4, and 5. So proximal phalanx 1, proximal phalanx 2, proximal phalanx 3, proximal phalanx 4, proximal phalanx 5. Distal, distal phalanx 1, distal phalanx 2, distal phalanx 3, distal phalanx 4, and distal phalanx 5. The problem is what happens with your middle phalanx. So with the middle phalanx, we don't have one in digit 1, but we have them in digit 2, 3, 4, and 5. So remember, we number these based on the digit. So this is middle phalanx 2, middle phalanx 3, middle phalanx 4, and middle phalanx 5. We do not have a middle phalanx number 1. Okay, so let's talk about the carpals. So whenever we're looking at the carpals, it's easiest actually to look at them in respect to the anterior aspect. And the reason being is when you look at the anterior aspect, you're able to see bones here that on the posterior aspect you really can't. So whenever we start with our mnemonic, the mnemonic is Sally left the party to take Cindy home. So when you're looking at that mnemonic, you're going to start at the thumb, but you're going to start at the proximal row. So when you talk about proximal, it's the closest to the point of attachment. So it's the part that's closer to your elbow. And then so your proximal row is closest to your elbow. Your distal row is going to be closest to your fingertips, right? So you're going to start with the proximal row. And the first one is actually a relatively large bone. It's this bone here. This is the scaphoid. Okay. So we have the scaphoid. We have the lunate. Over here, we actually have two bones in one. I'm going to kind of turn it to the side so you can see that there's this piece here and then there's this piece here. And there's actually just a tiny little line that's kind of in between them. So scaphoid, lunate, then we have the triquetrum and the pisiform. So the pisiform's kind of on the top here. So if you've ever felt on your wrist kind of this bumpy spot right here, once again, that's going to be closest to your pinky here. So that area there is you're going to be feeling that pisiform. And then you start once again by your thumb and read across as well. So scaphoid, lunate, triquetrum, pisiform. Then we have the trapezium. Trapezium is close to the thumb. Notice the rhyme there. Then we have the trapezoid. We have the capitate, and we have the hamate. The hamate kind of has this projection off the top of it as well. So the mnemonic is Sally left the party to take Cindy home. Scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, hamate or capitate, and then hamate. So Sally left the party to take Cindy